I'm here with Hanif Chatur, and he's a doctor at the Upper River Valley Hospital in Carleton County. And we're going to talk today about EVisit New Brunswick, which is a project that you're involved with, which is an online platform for care of medical care and for doctor's visits and so on, and specifically how that can help with mental health patients. So first of all, if I might ask, how did you get involved with EVisit in the first place, and when did that start?
Yeah, no, thank you first for having me, and I'm pretty excited to not only talk about EVisit NB, but just also about digital health innovation and how I think it can start to solve problems in mental health. So in about 2019, one of the now co-founders of EVisit NB, Dr. Serge Melanson, released a statement along with the other presidents of the medical societies of the Atlantic provinces, stating that virtual care was going to be explored more thoroughly in the delivery of healthcare in the Maritimes. And I was immediately fascinated by it. As an emergency room physician, it always perplexed me why 100% of the encounters that I was seeing in the emergency room, especially in follow-up, had to occur in person. Mm-hmm. We were already using telehealth for connecting patients in our emergency rooms with psychiatrists located in Fredericton. We certainly were doing it with our oncology patients, and the IWK had been doing it for years, along with sick kids, with pediatric patients who had specialized needs. So I started kind of thinking that there was something here that it resonated deeply with me, and then I don't know if it was coincidence, but all of a sudden I found that I was actually doing a fair amount of interactions on my phone. Questions, occasionally patients or individuals would send me photos. Starting to recognize that that this is probably not the best use of technology. You need privacy, you need security. We were, even though it was anonymized and you didn't have identifying factors, there was really no way of keeping track, and really it was more of an interruption rather than care. Later on in 2019, I connected with Dr. Jonathan Clayton, who was one of my residents, and he had been involved in virtual care, working for a company called Maple, which was a direct-to-consumer platform where individuals would be able to make an online appointment with a provider. So fascinated with this, I went out to New Brunswickers and I said, why aren't you using this? You're coming to the emergency room for simple problems, mm-hmm. Sometimes for follow-ups that could be easily resolved using this platform. Is it the cost? At that point in time, virtual care was not an insured service. It was considered a luxury. Medicare only pays for medically necessary services. So, for example, they don't pay for cosmetic surgery, for example. So this was kind of classified as convenience care, wasn't reimbursed by Medicare. And so I thought it was maybe a cost factor. Maybe, mm-hmm. People were apprehensive about paying it. But that wasn't it. It was a trust factor. Mm. So when I started asking New Brunswickers, they asked, who's on the other side? Where are they from? Are they from New Brunswick? Do they practice in St. John? Would I know them? Do they know about my circumstances? Do they know what's available to me? Do they know that I live in Plaster Rock and I no longer have a hospital and I have to travel sometimes 30, 40 kilometers?
Right.
And so they didn't trust the platform to meet their needs. Mm-hmm. So I started thinking deeply about this, and I recognized that healthcare doesn't move at the speed of innovation. It moves at the speed of trust.
Right.
And so I started looking at how can we still bring the best of technology and reconcile this idea that, trust is necessary for individuals to actually go and get care online. It's not like shopping at Amazon, or at least it hasn't been in my experience.
Right. And so the basic disclaimer here that I always do is that we got to be careful that we're not giving any particular advice about a specific issue.
Absolutely.
And so with that, when did you start kind of developing a platform for what EVisit New Brunswick is now?
Yeah, so I started in late 2019. I went and talked to patients because that's who I wanted to use the platform. And I asked them what they needed in order for them to really trust something digital to meet their needs. They told me that the most important thing for them was to feel like it was actually from New Brunswick, mm-hmm. so that, they felt like it would be something they could identify with, not a generic company like an Amazon or a TELUS or a Bell or, brands that are recognizable, but something that was more intimate.
Right.
So I got the EVisit idea, and then I married it with the New Brunswick idea, so EVisit NB. And then, I often thought, how do you build trust? Well, I know in every community, there's an individual, a doctor that we all wish was our family doctor. Sometimes you happen to be lucky and there's more than one.
Right.
So I started talking to them. I started talking to doctors that everybody wanted to be their doctor, the doctor's doctor, and asked them, what they thought about this innovation and if they would join me and if they would be on the platform. And some did. And I think that essentially allowed the product, the platform to increase trust. When you went there, you're like, if this person is there and this person is providing quality care, then maybe this is something I can trust.
So what kind of things do people use EVisit for now?
Yeah, so there's a range of conditions. I think that, there's everything from wanting, advice on chronic conditions like diabetes, COPD, asthma, to acute problems, urinary tract infections, hives, skin conditions. And then, of course, we've seen a significant amount of mental health, which is what we're here to talk about today.
Yeah, so let's kind of turn to that. It's a good time to talk about mental health. What percentage of EVisit New Brunswick's caseload, if you will, since you started it, would you say is devoted to mental health clients?
I'd say about 1 in 5 clients have, kind of a direct mental health complaint. So anxiety, depression, and, addiction, all sorts of things, that fatigue, which we've seen a lot of. So burnout,
of course.
So about 20%. And then we've also kind of have to understand that not everybody that has a mental health condition necessarily falls or gets classified into those. So,
right.
We're seeing a lot of people who are anxious about the future. We've got
they wouldn't be alone.
Yeah, this idea that there's this is I have 4 kids all under the age of 26. This is the first time that they've actually experienced a crisis that's existential. They're hearing things like World War. They're hearing things about nuclear bombs. This is not something that my children have heard in the last 26 years. This is not,
and those are stressful things for the best of us.
Exactly.
Adults,
and this is causing a tremendous amount of anxiety, about the future, and then of course it compounds, everything that we've experienced through COVID, being socially isolated, not being able to interact with people normally, university students. I know that speaking for my 2 out of 4 kids that are in university, it's not been a normal experience. It's been, it hasn't been social. It has resulted in moving from home, but not kind of having the opportunity to form those deep connections that, maybe some of us got the benefit of having.
Right.
So there's a lot of things that are happening that are exacerbating underlying mental health problems. And then I think there's enough going on and enough that we've experienced that is kind of challenging our resilience. I know it has certainly challenged mine as a physician and as a healthcare worker. It has not been easy over the last 2 years, and so I can appreciate what's happening out there.
And here's an interesting question that I know you and I discussed this before, and your answer was particularly interesting. Is what are the benefits of EVisit to mental health patients? And I think before I'd kind of challenged you a little bit on the privacy thing, and you actually pushed back and talked about, well, actually it could be more private in many ways.
Absolutely.
Can you speak to that a little bit?
Yeah, thank you. I think that it's a lot better than it used to be when I first started medicine. I think there's a lot less shame, there's a lot less stigma. I think that we're a lot more open-minded. But we have an opportunity here to talk about the privacy of the technology. The technology has to be something that people can trust, not only with their own PHI, but also they need to kind of feel like what they're sharing is not going to be overheard through a curtain in the emergency room.
Yeah,
that might be their neighbor or maybe a cousin. Not unusual where we live,
right? Where everybody knows everybody.
Exactly. Yeah. Privacy is very hard to ensure, especially in our crowded ERs. There's not always a nook and cranny where you can absolutely be heard, without nobody else overhearing. I think sometimes, being able to text, is not something, is invisible to everyone else. You could still be in your small apartment with your roommates and still have an intimate text conversation with your healthcare provider on a safe and secure platform, without having to worry about being overheard or without having to worry about
Right.
video.
And I guess the other benefit of that is it takes a big burden off the emergency room system. Not calling it a burden, but
Yeah.
to say that removes some people that maybe don't want to be there or shouldn't be there to getting the same care that they need without having to wait in line for hours and that kind of thing.
Absolutely. And I think that, when we talk about the word emergency, it's not really an emergency room. It's kind of like an all-purpose room, right? So an emergency room is there for our sickest patients, psychiatric, our car accidents, our suicidal patients, our patients who are just simply unable to function because it's so overwhelming,
Right.
Based on whatever their mental health crisis happens to be. And we're really good at that. When we see that, we've prepared, we've got skills, we've got staff, but as an all-purpose room, in other words, every single problem comes to the emergency room. It's very difficult to look after those patients who are still needing care in a timely fashion because our priority is these emergencies.
Right.
And so I find that sometimes with mental health, and I think that, it's fair to say that, mental health kind of becomes, our self-awareness and our perception of events. I'll give you an example. It's not unusual for me to speak to a mental health patient who is agitated or upset after having waited a long time. And I ask them, you seem agitated and upset. Is it because of what's happening in your life? And they feel like, no, it's because I feel like nobody cares about me.
Right.
And so, they can't process that they're waiting longer because they might be a car accident inside there.
Right.
I think mental health the nature of the disease somehow kind of distorts how we interpret things. It becomes personal, it's painful. And I think that, we need to make it so that we can capitalize on this opportunity where people are coming to us for care and we can deliver it in a timely fashion. And imagine if we could do that within the convenience of their own home, which is where I think virtual care's superpower is to get people the care they need, when they need it, where they need it.
What are some of the biggest challenges that you've had with EVisit New Brunswick in general, and then specifically, is there anything with mental health that's challenging for EVisit?
Something that's deeply important to us at EVisit New Brunswick is what we call the last 20%. So how do we don't want virtual care and digital health to exacerbate the digital divide. So there's two groups of individuals: our low tech, no tech individuals. In other words, people that don't have access to the internet, which is, there's large areas of New Brunswick that don't have fiber, that don't have high speed, that don't have 5G or 3G or 4G even. So, how do we get this innovation to them? How do we get this innovation to the elderly? I think when we think about mental health, and maybe, and I'm not going to use the word we, but I said it's not unusual when we think about mental health that we often associate with youth. But we need to remember that New Brunswick largely is a population of older individuals, and they've been disproportionately affected by COVID-19. They've been disproportionately affected in their special care homes, in their long-term care homes. They've been isolated from their families. People have been worried about infecting them. And they've been suffering, with mental health problems as a consequence of that. And they're digital immigrants.
Yeah.
And it's very difficult for us to get this technology in their home because it's simply not accessible to them. It requires us to really innovate and think outside the box about how we're going to get this innovation into the homes of individuals who have never experienced or used this technology for most of their lives. And that's our biggest challenge right now, is how do we get this important kind of transformative, innovative delivery of healthcare to the last 20%.
And what kind of, like, without going into details of it, what kind of success stories, what kind of things have you been able to deliver through EVisit to mental health patients?
I think it comes in our feedback, so our feedback from our patients is really important to us, and I'll tell you how we do that. Every patient that interacts with us on our platform is given the opportunity to tell us about their experience, both positive and negative. Mm-hmm. We ask them for a rating. We encourage them to tell us, what we can do better. We actively solicit feedback at the end of every single encounter, and we read them. And then we go back as a team and we look at what we can do to make things better. And I think that process over the last kind of 30,000 visits that we've performed has allowed us to kind of, get the care to our patients based on what they need rather than what we think they need.
Sure.
And the overwhelming feedback around mental health is, thank you for listening. Thank you for making this available to us. And I think there's an overwhelming gratitude that patients don't have to compete, mm-hmm. for time, energy, and space in our emergency rooms, for care when they need it.
What kind of things do they typically, I guess I could call it call in for or log on for?
Overwhelming sadness, so depression, mm-hmm. Anxiety, so being unable to stop their racing thoughts, calm their mind to the point where they find it difficult to go to school, go to work, mm-hmm. Participate in their own well-being, and certainly in their lives of their loved ones. So that has certainly been a huge theme. I think that there's also been, it's the depression anxiety spectrum that we've been seeing. We see a fair amount of individuals with kind of, and I know this may be something that your listeners and viewers will relate to, but not all mental health precipitates as crisis of emotion. There's a lot of individuals we've seen with pain, chronic pain, fatigue. Fatigue is a complaint, because I think that when you're burned out, it is as physicians, we do our due diligence. You come in with fatigue, I need to make sure that, there's a whole host of medical conditions based on our story or your story, based on my physical exam, and then based on testing that I need to eliminate. And then once we've done that, we're starting to recognize that, a lot of people are not tired, they're burned out. And that means that their ability to participate in a meaningful way, to access joy, to enjoy the outdoors, to gather again like we can, right. Is impaired. So how do you recover from this social isolation, if you can't even muster up the energy to participate in society when it's been reopened, and then starting to kind of have that person, at least consider that maybe this is depression. And
like, what kind of treatments do they reach out for? Is it sometimes just somebody to talk to?
Yeah, it starts with talking, right? Okay. I think that so it starts with talking. It's medicine's still about the story. That's mm-hmm. 90% of it, and sometimes it's about giving our patients a toolkit. Mm-hmm. And allowing them to go and test if those sets of tools are going to be enough for them to, to negotiate how they're feeling, mm-hmm. interact with the world, come back to us. Sometimes it's with medication. Mm-hmm. Sometimes it's with referral to our kind of mental health services that are available in most of our communities. Mm-hmm. And they've been a great partner. And then, I think sometimes it's about, alterations, changes. Right. A lot of our patients have been on medication for a long time that are no longer effective, and they need adjustments, they need changes, and we're allowed to kind of participate with them in those changes and see if it makes a difference. And
you've got not only doctors that are signed up, and nurse practitioners as well.
Correct. So, but the majority of our platform is nurse practitioners. Okay. So I'd say it's about 85% nurse practitioners and 15% doctors. Okay. Currently, physicians across New Brunswick are able to provide virtual care to their own patients in their own primary care practices. Mm-hmm. So during the day and after hours, MDs are able to have their patients access them. And if they happen to participate in a group, then those patients in the group can also access virtual care services during the day and after hours. However, once 4 o'clock or 5 o'clock comes around, most communities in New Brunswick don't have access to after-hours virtual care.
Right.
They might have access to some walk-in clinics that offer virtual care or in-person care, and then certainly, the emergency room has become an all-purpose room for care after hours and on weekends. So this is where we fill the gap. This is where individuals, can come and access us should they not be able to see their own primary care provider. I believe the numbers are 50% of New Brunswickers cannot access their primary care provider in less than 2 weeks. No fault of the primary care provider, just speaks to the fact that, we've got complex issues with access, for primary care in New Brunswick. We're a large province that's thinly populated. And so I think it's a difficult and challenging problem to solve, and it's one it's a solution that's in progress. So yeah.
And what kind of pushback have you had, from other medical professionals? I'm sure there's been some criticisms and some, what would I say, reluctance to embrace kind of an online platform. Are you able to speak to some of those challenges?
Yeah, absolutely. I think that, if I was to go back to 2019, where 98%, 99%, of care was being done in person, there was skepticism. You had a provider that was saying, we need to see you in real life, and that's care.
Right.
And now you had a platform that says, we need to see you in real life. We just don't need to be in the same geographic space.
And has that improved with COVID?
Oh,
you've seen big changes?
COVID has been a catalyst. I mean, I'll give you an example. Prior to COVID-19, in the 2 months before, we were seeing on average 3 or 4 patients a week.
Right.
With the adoption of virtual care and the announcement by the provincial government that it was going to be an insured service, we were seeing 100 to 150 patients a day.
You're kidding.
Right? That's
a huge uptick.
Right. Now, one is that it was provincially covered, so, it was insured, but it was more than that. It was actually endorsed as a valid delivery method for healthcare. Not all care.
Right. I'm not saying you're competing, but you're giving another avenue, which actually in many ways frees up the system.
Absolutely.
To do what it's supposed to do.
And, this is a great opportunity to talk about, the only way that care occurred once upon a time. If we can, everything, everything is, kind of BC, AC, before COVID, after COVID, Before COVID, all care had to occur in real life. During COVID, all care has to occur synchronously. In other words, I have to call you or text you or video you in real time.
Yeah.
I think the future of care is going to be asynchronous. We meet like this today, but maybe I can send you a secure email and ask you how you're doing on that medication.
100%.
And when it's convenient for you, after you've got home, you check that, you spend a few minutes saying, it's going okay, I'm a little nauseous, but you warned me about that. Looking forward to having it pass. And then what do you get from me? A quick thumbs up. And we've just actually had a follow-up about a medication that you've been prescribed without actually interrupting your life and actually maximizing the efficiency of the provider. Now, had you said, the nausea is overwhelming and I think I'm going to stop, I'd say, give it 3 or 4 more days, Tim. And if you're still nauseous, let's jump on again and talk about what else we can do.
Or then you streamline into let's meet at a in person.
So all of a sudden we're using technology and maybe to asynchronously communicate and follow up in a seamless way. And I think that level of efficiency and that level of innovation might actually unlock capacity in our system without actually having to bring in any more human beings.
It's interesting because you're talking about that. And I'm immediately thinking that the justice system is very similar, and that over the past couple of years, we've been doing more Zoom meetings for signings. We've been doing hearings over video or telephone. Now, I don't want to go too far on this, but I'd love to see that change as well, that was more of a permanent fixture, because it it seems much more productive
Absolutely.
than how we did things before COVID, so to
Yeah.
speak.
And, there's, probably the single biggest criticism of virtual care is, what about things that you need to touch the patient for,
Sure.
right? So, what's the role of the physical exam? And, do you, and I think that most, that's something that comes up a lot by physicians.
Mm-hmm.
And so I went and talked to patients. I said, so how often are you physically examined? Just out of curiosity, I started asking them, are you physically examined 100% of the time when you go see your doctor? Is it 10% of the time? Is it none? And it's been all over the place.
That's true.
It's variable and it's inconsistent, and to a large extent, it's not really predictable.
No.
So the same condition might require a physical exam by one provider and not another. So there doesn't appear to be even a standard. So I think that we've been looking at how to bridge that gap. So we see patients virtually. We cannot physically examine them. We can't touch you yet. There's technology that we're acquiring and experimenting with that's incredibly exciting, using like AI and essentially a doctor in the box. So in other words, you just pull it out of your drawer and I can listen to your heart, listen to your lungs, check your temperature, get an ECG, get all the metrics, look in your throat, look in your ear, take photos of everything, and even have you maybe do it yourself using an AI and send it to me in the morning. Because why would I have to examine you in real time? And you can maybe even examine yourself every couple of days to see how your pneumonia is progressing. And you can send that to me, and in the morning I can just listen to your heart, listen to your lungs, look at your temperatures and stuff, and be reassured that things are going in the right direction. But I digress.
Yeah.
We recognize that as a legitimate criticism of virtual care. Patients need to have hands because we need to not only be able to look and listen, but we need to be able to feel.
Sure.
And so we've been very fortunate to be able to engage with Horizon Health Network, where if we feel like a patient needs a physical exam and they don't have a primary care physician, they've developed an innovative program where we seamlessly interact with each other and move patients in and out of the system. They can see us first virtually, they can get physically examined, and then they can come back to us. We can combine those two things and then get the patient what they need. So there's been a tremendous amount of innovation in all of New Brunswick, and that's just one example, and there's countless others.
So what do you think's next for EVisit New Brunswick?
Yeah, that's a great question. Yeah. I think that, now that we have kind of crossed a critical threshold in New Brunswick where, almost, about 40,000 visits will have transpired, so 1 in 20 people will have had had an encounter on EVisit NB. And I think that they will have hopefully shared that experience. Our experience has been that it has been overwhelmingly positive. We measure that every single day. What do our patients say? How do they rate us? What is their feedback? And we fix things on the fly. Our hope is that, we'll be able to see it kind of grow into all segments of healthcare delivery. So, follow up in the emergency room. Let's say, for example, you came and saw me at the Upper River Valley Hospital and you came in with a red leg. I gave you some antibiotics. Instead of bringing you back the next day.
Yeah, just schedule a virtual appointment.
Right. Or even better, maybe you can just send it to me asynchronously and I can take a look at it and say, that's great. You don't need to come back. We don't even need to do it in real time.
Right.
We can just simply say,
whenever it's convenient.
Exactly. And if I need you to come back, I'll let you know, and then I can see you synchronously. So I would love to see it kind of widely adopted for follow-ups in our emergency room, so that we're not bringing these rechecks in for really a 30-second hallway visit and say, that looks great, Tim, see you. Thanks for waiting 5 hours.
Right.
It's all about efficiency. It's all about patient safety, of course. I would like to see it, I think that we need to look at, you've got a public space, and how can we ensure privacy, and how can we use those public spaces to ensure that everybody, regardless of means, needs, regardless of whether they have access to broadband, cellular technology, can actually use our public spaces for access to healthcare.
Right. So if you had a private room somewhere that you could schedule a time for it,
and then just do a virtual visit and have it be facilitated, respectful of your privacy, but certainly have technology there that's accessible in public spaces. So there's so much room to innovate. So why do you have to go all the way to the Upper River Valley Hospital for a recheck. Maybe you can just walk down the street, have a virtual visit in your private spot in the library, have your arm looked at, recognize that you don't need to drive all that way for a recheck, and go right back to work wherever that happens to be if you don't have access to the internet. So there's so much opportunity to just continue to innovate. So I'm excited about all of them.
Good. And I can speak from a few friends of mine that have talked to me. I knew one that just had to get a prescription refill,
Right.
and basically said it was very simple and easy to do, and that was really helpful. And then I had another friend who needed some pain medicine,
Right.
and that, said that was a great experience, and why go to the hospital to do that when it was a really simple matter. And also, if you can't get in to see your family doctor right away, it seems like a no-brainer. But well, thanks so much for taking a few minutes to talk to me about this. And I think what I'm going to do is I'll post. I think you have a website, and I'll post some information on that.
Sure. Yes,
what I can, so that I can pass it on.